G'day guys, Alex from Axe Physio here. Today we're talking about ACL Rehab Phase 2. So this occurs after Phase 1, which was the initial recovery from surgery. Phase 2, we're looking at introducing proper strengthening and motor control or knee control exercises. So it's really important that from Phase 2 onwards, we've got a really clear idea of what our ACL rehab should look like. And what I'm going to show you today is a really clear way of setting up the rehab to making sure that you've done everything that you need to do in a broad sense. So by looking at your exercises, not as specific exercises, but in terms of movement patterns or movement streams, you're able to make sure that you haven't missed anything. So examples of this are a squat pattern, we've got a hinge pattern, we've got things like ankle pattern and balance patterns. We're looking at pelvic control. By making sure that we've got all these different streams identified, we can then put exercises into those streams to make sure that we have ticked all the appropriate boxes, and we can also make sure that they're hard enough to get the responses that we want as well. All too often people might be doing a fairly good rehab, but they're just missing out a few of the different streams that hasn't been identified, or they're doing all the right exercises but they're just not quite hard enough, and we'll cover that as well. So what you will learn from watching this video is what are the different streams that I need to consider at this point in the rehab process, and what exercises should fit into those different streams. Just remember, this is not a specific ACL rehab for you, but this is just to give an example of what a potential rehab program should look like. So guys, we're going to jump into our first movement pattern now.
Our first movement pattern or movement stream that we're working on today is static balance and proprioception, and the first exercise to kick this all off is single leg balance. Simply standing on the leg that you want to work on, have the other leg off the ground. We don't want it touching the same leg, so it's got to be in the air by itself. We're then trying to hold this for a minute or more. That is the goal. That is sort of a bit of a benchmark for people. Make sure that you're in a safe environment, that you can grab onto a wall or a bench in front of you, so that if you are on your affected ACL leg, that you have the ability to grab on and stop yourself from falling over. The leg that isn't working, so the one that's in the air, is not allowed to touch your stationary leg. We want it to be by itself. Making sure that when you're doing this exercise, you're trying to work really hard through the entire leg. The knee is slightly bent. You're working hard through the foot and through your hip to maintain your balance. Our next pattern that we are working on is the lateral hip pattern, and the first exercise for this is hip hitching, also known as hip hiking. Now this is a really important exercise as it's the first building block of strengthening the lateral hip. The leg that is on the ground is the leg that is working hard here. So in this case, my left leg, the one that's on the ground, when I drop down, I am feeling passive, nothing's working, and then as I bring my hip up, that same leg, the hip muscles where my hand are working hard to contract and bring the pelvis to a neutral level. So when we start, we're in that tilted position, and then as we finish the rep, we come up to that flat hip position. This is really important as we need a stable hip when we jump and land and cut and change direction. And this is a really nice way of just introducing appropriate hip control. We're not really building strength here. It's more this movement pattern, this movement stream, getting mastery of our hips early on, so that when we can add load, when we can add weight, we can do so with confidence. Just remember that this isn't a balance exercise, so hold onto the wall or hold onto a broomstick handle so that you can really focus on getting the correct movement around that hip. Our next movement stream that we really want to get a hold of is a double leg squat pattern. We can do this in a number of different ways. There's a back squat, front squat, overhead squat. It's important that we develop competency when doing these squats to allow you to load up later on. Starting off with a high box squat, it's a nice way just to get the early squat pattern happening, especially early on after surgery. It's a limited range of motion, so you can be quite confident just to work on your form and technique. No, you're not going to be really getting a lot stronger by doing this, but you're really going to be able to focus on good technique. And then once it starts to get easier, once your knee range of motion improves after surgery, we can then reduce the box height to make you have to go down further. and then you have to then learn to control the new available range of motion. So the medium box height, for example, we're sort of getting down towards that 90-degree angle at the moment, making sure that the knees are tracking over our second toe. The knees are allowed to come over our toes as well, and we're sitting down into that squat as well. For some people, they may want to sit and have a break. For others, we can then just touch and go. Ideally, setting up so that it's more of a touch and go environment would probably be ideal. However, it's not as important at the moment. Low box height, getting to that 90 degrees is sort of where I leave things early on, as if you have some meniscus involvement. Most of the time there's restrictions to around loading below 90 degrees up until a certain amount of time after surgery. That's generally between 4 to 6 months, depending on what your surgeon has told you. Okay, so making sure that you're developing mastery at high, medium, and then low, and progressing as your post-op orders allow you to. Now, people will progress quite quickly in this first block after surgery. Every day, provided we get the swelling under control and pain management under control, we should be starting to see improvement. And when available, I get my patients to add a little bit of weight. So I've just got 5 kilos here in a front squat or a goblet squat position. This is a great way just to add load to the available range of motion. So you can add load at a high box height, add load at a medium box height, and eventually add load at the low box height. Personally, I would tend to wait till they're at the low box height to add too much weight, as I'm focusing on good depth and good form. But for whatever reason, sometimes people's range of motion takes that little bit longer, and provided they're not getting irritated or sore, swollen from doing the squats, and they just don't quite have the range of motion yet, you can add a little bit of load at like a medium box height level, which will allow that person to get a little bit more strength, provided that they don't lose any technique or form, and that they feel okay after the session. They don't feel like they got too swollen by adding more load. Our next movement stream that we want mastery over is a single leg squat pattern, which will continue all the way through the rehab as well. We're doing a single leg squat, just body weight. We can start at a high box height, go to a medium and low box height, and then we can add weight as well. So at a high box height, medium box height, and a low box height. The same principles apply as the double leg squat. We want good form. We're making sure that the knee's tracking over the second toe. We're not getting too much unwanted valgus where the knee comes in towards the midline of the body. The hips are in a nice neutral position, and we're not collapsing through our hips like when you think back to our hip hitching exercise. Now, this first block, people are going to vary as to where they are in the program. So for some people, they won't be doing single leg squats on their leg yet. It's just too sore, it's just too swollen, and they're going to be just doing this on their better leg, the non-surgical leg. However, there are some people early on after surgery that can tolerate doing a high box height, a medium high box height, body weight, single leg squat. And then towards the back end of this first block, which is sort of up to about 4 weeks, there'll be people that are well and truly doing a low single leg squat off a low box. And there's some people that have just started to add some weight as well, maybe at the level above at the medium box height, they're doing single leg squats with weight. It really depends on pain and swelling during and after the session, and of course technique. Technique is of the utmost importance in these first phases, the first 10 to 12 weeks after surgery, as you can't really add a lot of load anyway. So make sure you get the technique down right, as having great patterns, developing great patterns early is going to lead to adding on a lot more load and weight later on down the track. Don't get impatient, let's get it right the first time around. Our next movement stream we're working on is a double leg hip hinge. We're working on hinging, keeping a nice straight back, coming down with a broomstick or a barbell just to at the knee height, just to above the kneecap. This can be a little bit of a sensitive movement for some people early on, especially the ones that have had a hamstring graft, as this is essentially lengthening the hamstring, so it should be done with caution. I will always start with body weight and just ghosting through the movement with my patients that have had a hamstring graft. For people that have had a patella tendon graft or a donor graft, they might find this quite easy as their hamstring isn't compromised. Really going with how your symptoms feel. It's not about adding weight, it's just about getting that hinge pattern done correctly. So begin with a broom and progress very slowly and incrementally. So our next movement pattern is a single leg hip hinge, and our first exercise is going to be a single leg RDL. Now once again, this is a hip hinge, so for people that have had a hamstring graft, they need to be very progressive and move slowly through the movement. Try to move very incrementally each rep and slowly to explore the range of motion that you have. It's not about getting all the way to the ground, it's just about exploring and gaining understanding of that movement pattern after you've had the surgery. So we want to get that back as soon as we can, so that when we want to add weight, we want to do a full range of motion RDL in a few weeks time. You've already practiced that motion, so it's not a surprise, and you can pick up, add load quite quickly, making sure that you're balancing with your hand on the box, and we're not turning this into a balance exercise. At the beginning of the block, the RDLs may only occur on the non-surgical side. However, as the knee progresses and you get more confident with it and it's not as swollen and sore, definitely starting to get some RDLs on the affected leg as well is definitely ideal, even early on. The next movement stream or pattern is the split leg pattern. So this encompasses things like split leg squats. However, in this, we're just going to be doing our straight leg raise. You are very recently after surgery, and so doing some lunges is probably just going to flare the knee up. So we want to make sure that we're capping the amount of load that we're putting through that leg. So just adding in some straight leg raises that are weighted is generally how I get people, just to add a little bit more quadriceps load. We're trying to get that bulk back, we're trying to get the quad size back. So making sure that the knee is nice and locked, there's no lag in the knee, meaning that the knee is not floppy, and we're just really getting some strength through that quad and hip flexor. Moving on to lunges and things like that at a later block where we will actually do proper split leg work. The next movement stream that we're going to be looking at is the pelvic stream or pelvic tilt stream. This is looking at a forwards to back type motion where you may have heard it being referred to as an anterior tilt or a posterior tilt. So doing this exercise, we're trying to make sure our back stays flat, which means we've got to tilt our pelvis back to make it flat on the ground. If I could move my hand underneath the lower part of my back, that would mean that I'm in more of an anterior tilt where I'm arching with my back. I don't want to arch, I want to have my back nice and flat. And so I'm strengthening in that position by lowering one leg down at a time. I'm having to hold my trunk or my core in that solid flat position. If I feel that my back is arching, that's a bad rep. I want to make sure that as my leg goes out, my trunk stays in the same position and I'm able to control that position on the floor, so that when we do things like sprinting and change the direction later on, we've got more control and awareness as to what our pelvis is doing. You can see in this standing position, what we want to see is that the back doesn't arch when the leg raises up. Now this isn't an exercise, but just to demonstrate that having that flat spine, having that control of that anterior or posterior pelvic tilt is very important for us as people recovering from ACL injuries. We want to make sure that we've got control of our hips side to side, as we had in the lateral hip movement stream, and also a front to back movement stream, which is the tilt movement stream that you are looking at right now. So get that back flat and get nice and strong in that position. Now, not necessarily a movement stream, but a muscle group that we want to pay particular focus to is the hamstring. We're just going to be working on some double leg glute bridges. This is a very low load hamstring exercise. However, it is definitely working when doing this. It's also a great posterior chain or glute exercise as well. Push down through your heels and lift your trunk to neutral. However, do not overarch through your lumbar spine. We should be posteriorly tilting or tucking our pelvis underneath us, exactly like we were in the exercise beforehand, where we are tucking our pelvis up and we're getting nice and flat. We don't want to feel like we're overarching through our back here. We should be a little bit tight through our stomach when we're doing this exercise as well. Our next movement stream we're looking at is the ankle. Now the ankle is of the utmost importance in ACL rehab, and the exercise we're working on is calf raise holds initially, raising up, trying to hold for up to 10 to 30 seconds. Once you can do that and you can achieve full lockout with your ankles and your knees, doing some toe walking is the main exercise to do here. When we exchange from the left foot to the right foot, there should be no drop through our knees or through our ankles. So try to maintain that high ballet-like position where we're really trying to be up on our tippy toes as much as we can. It's a great early calf strength exercise, but it's also great practice at keeping that knee locked and straight. Now our trunk anti-rotation pattern and what our first exercise will be, which is the pull-off press, and it'll feature quite heavily for a lot of people throughout their rehab, is a great way to work on resisting rotational movements. When we run and we quickly change direction, we're moving our body in one direction, so our force is going one way, and then as we go to change direction, we're then fighting against that force. So it's really important that we develop some ability to counter different forces that we put on ourselves and other people place on us as well. So making sure that we address some anti-rotation is a great way to work on preventing injuries as we go back to sport, and we can start that early, as if you're able to stand, you should be able to do a light pull-off press. So when standing, making sure that you're holding the band with two hands, you're in a slightly squatted position. You try to keep your hands in midline so that they're not deviating from the middle. So if you can imagine your hands are roughly near the belly button and you're pushing out until your arms extend and then bringing the arms back in towards you, maintaining tension the entire time. And we repeat that for the desired number of reps. Now we're going to be moving on to a upper body maintenance program, and for some people this just will not be what they will do in the first month. They're going to focus more on just the lower body, which is absolutely fine, but when dealing with people that take their training quite seriously, the professional athletes, we want to make sure that we do maintain their upper body strength as well. So we want a horizontal push, which is going to be bench press. Now this could be machine bench press, it could be free weight, but I would suggest don't go to the gym by yourself and try to set up with free weights, because you've got to pick up the weights, you've got to twist, and on that knee it may just be a risk that we don't want to take. So if you are going to do that, make sure you go with a partner for all these exercises. Otherwise the pin loaded machines where you just sit and push and pull would probably be ideal. So up next we've got a vertical push. This is things like a dumbbell shoulder press, a barbell shoulder press. It could be like an incline bench press. It's sort of in between, but essentially it can be pin loaded or safely given to you by a partner. We've then got a vertical pull, which is a chin up. This could also be a lat pull down, which is the safe version of doing this. I just don't have any footage. These are also quite dangerous if you don't have a partner. Horizontal pull is a little bit safer on the knee, but this could just be something like a seated row or a seated pin loaded or hammer strength machine. Now for cardio maintenance, single leg rowing, it could be single leg assault bike. I've got a whole video on cross training for ACL that's in the playlist, so check that out. But guys, I've never really seen anyone not get back to sport because they weren't fit enough. So this is not necessary for people early on in the rehab, for the majority of people, even the professionals. But for people that are a bit itchy footed and they need to do some form of cardio, this is an option for them. But once again, not absolutely necessary to getting back to sport, especially within the first month after surgery.
So those are the appropriate movement patterns with some extras regarding the upper body and the conditioning blocks. Just remember, the conditioning block isn't really that important in this early phase. It's really for a select few that might be extremely motivated and their knee is responding extremely well to the surgery. Just remember that the single leg squats and the single leg RDLs on the surgical knee may not be possible from week 1 of phase 2. They may come towards the back end of this block, which is roughly about 4 weeks long, depending on how well you are progressing. Just remember, it's not really about improving on the amount of weight that you're doing, it's about getting supremely confident movement control about your body. So you've got really good ability to move your hips in the right way and control it in the right way. You've got really good balance, and that your squatting technique and your hinging technique is on point, so that later down the track we can add on weight and we're not having to worry about your movement pattern being the reason why you can't add weight. It's just adding weight and adapting. So you'll actually end up rehabbing faster by doing it this way. I would tend to suggest that in this early phase, 3 to 4 days a week is a fairly reasonable way to set up the rehab. It might be that you rehab on a Monday, Wednesday, Friday, Saturday, so 4 days a week, or it might be something like a day on or a day off, whatever fits the schedule better, as long as your knee is getting adequate time to recover. One thing I never like to see is people exercising every single day and the knee just gets bigger and bigger and more swollen. This isn't ideal. If you think about how you would train gym normally, bench press or squats, you wouldn't train it absolutely every single day, as you would not have enough recovery for the next session. And in fact, you'd be doing yourself a disservice, because later on the knee will still be swollen, and when you should be squatting heavy, you won't be able to. People will ask, well, how many sets and how many reps? At this point in time, your knee's tolerance is going to be really poor compared to what it would be usually. So in the vicinity of 2 to 3 sets of no more than probably 5 to 8 repetitions is what a lot of people will be doing in this phase. Just remember that more weight is not better. Great technique is better, and getting that knee adapting and making sure it's not too swollen is obviously exactly what we want in this point in the rehab. So guys, if you feel that you've learned something today, I would really appreciate it if you shared this video with someone that needs it. And if you have any questions, just drop them in the comments below. So I really hope you guys have a great day, and I'll see you in the next video. Bye for now.